So what happens after delivering that energy? It happens what you normally prevent in your patient. You are creating an artificial exacerbation. You're injecting something, the patient has to go through that exacerbation phase. You have the inflammatory response. So you see all the biomarkers you normally see when the patient is coming in with a bronchitis. Increased leukocytes and everything is increased, and the patient feels that. So when he feels he has an exacerbation, then you know it works. We're having that inflammatory process over the time. After 30 days, it leads to the fibrosis, and then it leads to the scar formation, and then the shrinking process is available by analyzing the CT scan, analyzing the X-rays. The important point is it takes time, and you have to explain it to the patient in advance. The patient expecting this, they are coming in, they're getting the bronchoscopy, and the problem is solved when you take the scope out. We have to explain to the patient, it takes time, nothing happens. Maybe you feel an exacerbation after the procedure, so you feel worse after the procedure than before, but over the time you see all the response we want to see. Here that example, you see some examples in red is the right upper lobe. We deliver the energy, and you see over the time the shrinking process, so the volume, the local volume reduction was reduced, and even you see on that slide 6 months there was a changing minus 60%, but even after 12 months minus 75%. So it takes time, but then you have a persistent local volume reduction, and the patient should have all the effects you hoped before to give him.